Well, there's thousands of failed medical theories every century, going back 5, 6, 7,000 years to the days of the pharaohs. In the 20th century, 21st century are no different. We have thousands of failed medical theories in the 20th century, and already that many in the 21st century. Now let's look at this, and I want you to get a hold of the books Epigenetics, The Death of the Genetic Theory of Disease Transmission, Dead Doctors Don't Lie, Rare Earth's Forbidden Cures, and Black Gene Lies. Those 4 books cover the subject extremely well, highly referenced, so you can chase things down if they sound unbelievable. Well, let's start out with genetics again, which is the probably the biggest failed theory the 20th and 21st century. Trillions and trillions of dollars are spent almost by the minute worldwide looking for genetically engineered genes that replace bad genes that are theorized to be bad genes to cause disease. Well, let's have a look at this. Let's start out with some of these diseases that are said to be genetic, which are not. Type 2 diabetes. Type 2 diabetes is a deficiency of a single mineral. Okay? We've known that for 80 years. It's not like it's very hard. And we can support and promote healthy blood sugar levels, healthy A1C sugar levels, or methemoglobin levels. And we can also support healthy sugar and carbohydrate metabolism at the cellular level. There should not be anybody in the world with type 2 diabetes, yet it impacts close to 30% of every industrialized nation, and after 10 years of a third world country becoming an industrialized nation, they're financially broke because of type 2 diabetes. Okay, it's a very simple disease to prevent, very simple disease to get rid of. Okay, it's a deficiency of a single mineral. Obesity has nothing to do with eating too much or lack of exercise or genetics. Obesity is a deficiency of a single class of nutrients, any one of which can cause people to gain weight if you're deficient in it. But if you're deficient in 2 or 3 specific ones, you'll be a 300, 400, 600, 800-pound person. So again, I want you to get a hold of the books Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Dead Doctors Don't Lie, the book Rare Earth's Forbidden Cures, and the book Black Gene Lies, and this will be evident and clear to you. And then let's look at, say, Alzheimer's disease. Alzheimer's disease, of course, doctors first thought that was due to contact with aluminum, and all that did was send Revereware out of the country to India, 10,000 jobs, and because everybody was afraid of cooking in aluminum pots and pans. Okay, aluminum in genetics has nothing to do with Alzheimer's disease. It's a deficiency of a single class of nutrients, all driven by medical doctors who are paid. The American Heart Association was paid by Procter & Gamble $1.7 million to actually endorse a new product by Procter & Gamble and to demonize cholesterol and saturated fats so they could sell that new product. And the American Heart Association should have their tax-exempt status taken away from them, and same thing with the Procter & Gamble should be shut down because of all the people that die from that failed theory. And let's look at high blood pressure in the black community. Certainly not genetic. It's a simple deficiency of certain minerals. And, of course, if they have kidney failure, the kidney will release a hormone called renin, which drives your blood pressure up. And heart disease has nothing to do with genetics. Okay? Heart disease of all kinds has nothing to do with genetics. Heart disease, let's say congestive heart failure, is due to a deficiency of a single vitamin. Cardiomyopathy heart disease is a deficiency of a single mineral. I've personally done 1,700 autopsies on kids under the age of 12 that have died of that one. And then there's coronary artery disease. We have plaques plugging up your arteries. That has nothing to do with genetics or cholesterol and saturated fat. That is simple inflammation caused by eating microwave popcorn, caused by eating processed meats with nitrates and nitrites, trans fats, heterocyclamines and acrylamides, oils, okay, and glutens. And then what about thrombotic stroke, where you get a blood clot in the brain, or coronary thrombosis, where you get a blood clot in the coronary artery and cause death? Well, these are not genetic, caused by deficiency of a single nutrient. Omega-3s are a ratio problem between omega-3s, 6s, and 9s. Okay? And so let's look at sickle cell anemia. Sickle cell anemia is not a genetic disease in the black community. It's what's called an inborn error metabolism caused by a birth defect of the cells in the bone marrow when mama was deficient in nutrients when the bone marrow cells were forming. And so the bone marrow can only make dysfunctional hemoglobin. So you get sickle cell anemia. Now, the same disease occurs in the white community, but you can't have black genes in white folks and white genes in black folks. So the same disease is called thalassemia in white folks and sickle cell anemia in black folks. Of course, I've seen it in deer and antelope and so forth. And, of course, same way with type 2 diabetes. I've seen that in alligators and crocodiles. Okay, so how does an alligator and a crocodile get type 2 diabetes if it's a genetic disease in humans? This is all very silly. So, again, I urge you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Dead Doctors Don't Lie, the book Rare Earths Been Cures, and the book Black Gene Lies, and appreciate that doctors have missed it by a million miles. Okay, none of these diseases are genetic. The only thing genetics does is control your eye color, your hair color, your skin color, determines if you're a boy or girl, and that your liver cells will make liver cells, your heart cells will make heart cells. When babies are born with birth defects, it's not from genetics. Mama was missing something during the formation of that baby. It's a nutritional deficiency in the embryo. Okay, you just have to remember, doctors were very ignorant 200 years ago. They're still very ignorant. Well, hang on, we'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about vitamin B12 today, as I've got a story here from Fox News that is headlined, Low B12 Seen in Aging, Autism, and Schizophrenia. They say that the brains of the elderly and younger people with autism and schizophrenia may share a common link, and that is low levels of vitamin B12. They say the fact that blood levels of vitamin B12 do not always mirror brain levels of the vitamin, and that brain levels decrease more over the years than blood levels may imply that various types of neurological diseases, such as old age, dementia, and disorders of autism and schizophrenia, could be related to poor uptake of vitamin B12 from the blood into the brain. All reported in the journal PLOS One. It supports an emerging theory that the human brain uses vitamin B12 in a tightly regulated manner to control gene expression and to spur neurological development at key points during life, from the brain's high growth periods during fetal development and early childhood through the refining neural networks in adolescence, then into middle and old age. B12 plays a crucial role in blood formation and the normal functioning of the nervous system, found in foods derived from animal sources, although some plant-based foods can be fortified with B12. The new study, led by Richard Death, a professor of pharmacology at Nova Southeastern University, they examined the brains of more than 60 deceased individuals, ranging in age from a fetus and in late stage late stage of gestation to 80 years, and the study included 12 people with autism and 9 with schizophrenia. In this first study to compare levels of vitamin B12 in the brain across the human lifetime, and the vitamin B12 levels in the brain were 10 times lower than in the oldest people compared to the youngest, reflecting a gradual, natural, and consistent decline over the years. From the elderly, this decline might be a bad thing, but not a bad thing. They say lower levels in advanced age may offer some degree of protection from slowing cellular reactions and production of DNA-damaging chemicals called free radicals. They go on to say, in previous work, Death found that the body's creation of biologically active forms of vitamin B12 produces free radicals as a waste product. The levels of B12 that are too low can be detrimental. At some point, extreme disease in metabolism is not compatible with cell survival. And they say numerous studies have searched for an association between vitamin deficiencies and neurological disorders. There's been no definitive study, however, indicating that autism or schizophrenia can be caused by deficiency or treated with vitamin supplementation. I would think you might disagree with that.
Yeah, and of course that's going to be worth a flourish here. Yes, because in the book, Rare Earths Been Cures, I show people how to diagnose ADD, ADHD, and autism themselves very accurately in children of all ages and also in adults. And, of course, I knew then there was actually every brain disease you can think of, including ADD, ADHD, autism, schizophrenia, psychoses, anxiety attacks, panic attacks, depression, manic depression, bipolar disease. Every brain disease you can think of is due to a nutritional deficiency of the brain. And vitamin B12, of course, as you pointed out in that article stated, vitamin B12 deficiency can cause a type of dementia, vitamin B12 deficiency dementia, very specific. easily reversed. It goes along with pernicious anemia. And, of course, it's one of those things where, again, get the books Epigenetics, the book Dead Doctors Don't Lie, the book Rare Earths, Ventures, and Black Gene Lies, and supplement, and save ourselves. Thank you, Doug. Super job. We'll be back with Dead Doctors Don't Lie after these messages.
Aromatherapy oils have been prized by ancient cultures for thousands of years. Longevity's ancient legacy, true aromatherapy, is no exception. Essential oils are the fragrant life essence from plants that are gently removed through the process of steam distillation. Longevity's ancient legacy essential oils are of the purest concentrations from the most respected and ethical distillers worldwide. Many ancient legacy oils come directly from families in the East which have been distilling essential oils for over 100 years. Keep Ancient Legacy's tea tree oil in your medicine chest for first aid. Tea tree oil is great for soothing the itching and stinging associated with insect bites, burns, scrapes, and other skin irritations. It's also effective as an antiseptic. To learn more about aromatherapy and essential oils, contact your local Longevity associate today. And don't forget to ask about business opportunities.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine-tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I got to tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Longevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities.
Okay, Doug, let's go to callers.
Let's head to Branson, Missouri, and Nancy, you're on with Dr. Wallach.
Nancy, you're on the air.
Oh, hello, Dr. Wallach.
Hi, how can we help you?
I am calling about my cat, and I'm glad you're a veterinarian and you can help me.
Okay.
He's 16 years old.
Mm-hmm.
He has what they say he's now in level type 3 kidney disease, and he had a seizure. He had just one, but it scared me to death.
Mm-hmm.
And he's had high blood pressure and tachycardia, but that's gone down, so they took him off his medicine.
Okay, and how much does he weigh? How much does a cat weigh?
He's in about 10 pounds.
Okay.
He's not a big cat.
Okay, now is he getting dry cat food or?
Well, I'm giving him both.
Okay. Well, make sure. What would you do, Sharon? Let me ask you. You've had cats and dogs. What do you think is going on here? This cat has kidney failure. He's had a seizure, high blood pressure. What do you think is going on here?
Well, he might have a gluten intolerance.
Yep, I think Shar is exactly right. I think your cat has a gluten intolerance, not absorbing nutrients even from perhaps good brands of cat food. So you want to read the labels, particularly on the dry cat food. Make sure there's no wheat, barley, rye, or oats. Read the moist cat food and see the same thing. And then what would you give this 10-pound cat, 16 years old?
Well, I'd give him, or her, him, Arthritis for sure, and then I'd also grind up the Ultimate Daily and the Niacin Plus.
Mm-hmm. Very good.
Based on his body weight.
Yep, very good. And so, as Shar says, Nancy, you want to give a half a scoop, because it's one scoop for 25 pounds of body weight, to give a half a scoop of the Arthritis crystals in your cat's food for general nutrition, great vitamin mineral supplement. You have to throw in a couple of the EFA Plus capsules, puncture them, and squeeze that fish oil on the cat food for the omega-3s. And then, as Shar said, I would go ahead and take 1/2 of 1 tablet a day of the Ultimate Daily Classics and go ahead and grind that up into a powder and mix it into the cat food. That would support healthy blood pressure, support healthy kidney function, and let's go from there. Give us a call, every time you go into the doctor or the veterinarian or once every month or something like that, and let us know how the cat's doing. You can certainly call anytime and you give us an update or have more questions. And I urge everybody out there that has a pet, get that Arthrodex, give them the EFA Pluses and the Arthrodex. And, of course, if they do have other challenges, then we've got to add some of the secret sauces to that. And pets respond very well to these programs because they're originally designed for animals. We've just adapted them for human beings in longevity, but these programs are almost always originally designed for animals. Okay, we'll be back with Dead Doctors Don't Lie after these messages.
Well, let's head to Sarasota, Florida. And Amos, you're on with Dr. Wallach.
Okay, Amos, you're on the air.
Okay, I had macular degeneration eyes, and I have taken 6 different kinds of vitamins, a total of 42 vitamins a day. And I'm just wondering if I've taken the right ones. I've been on it now for 120 days. And I just want to know if if I'm taking the right ones or should I take something else. I don't know.
Okay, well, how much do you weigh?
I weigh about 144 pounds.
Okay, do you have any other issues? Any high blood pressure, diabetes?
No. I'm on gluten-free, and I eat no fried foods.
Okay, how long have you been gluten-free?
Ever since I started, since the 10th of October.
Okay. Now, when you say that you've been taking lots of vitamins, are you taking longevity supplement programs, or are you just getting stuff out of the drugstore and the health food store?
I can't read it.
I'm sorry, say again?
Taking your longevity, yeah.
Okay. Okay, well, at 144 pounds, what would you do for a guy with macular degeneration, Shar?
I get him a healthy brain and heart pack, and give him extra selenium.
Okay, what else would you give him?
For macular degeneration, probably immortalium for stem cell growth.
Yeah, immortalium, very good. I'd go ahead and take 2 of those twice a day. It's 2 bottles a month to get stem cells to kind of encourage the retina of the eye to rebuild itself. And then what would you do to get the auric points up there?
And the BTT 2.0 tablets.
Okay, again, 2 of those twice a day. That's 2 bottles a month. The Beyond Tangerine 2.0 tablets. And that's for the auric points to help the body and the eye protect itself from free radical damage. And you guys are going to have to change your diet. What kind of diet would you put Amos on, Shar?
Well, he said he's on a gluten-free diet. He needs to make sure he really is on a gluten-free diet. And obviously no meat with nitrates or nitrites, no oils, because that causes all kinds of trouble.
Yeah, and let's see here. Yeah. Okay, that's where we'll start. Make sure, as Shar said, no fried foods. You already said you don't eat fried foods, but no fried foods, no processed meats with nitrates and nitrites, no exceptions, no oils. That includes microwave popcorn, theater popcorn, olive oil, coconut oil, margarines, mayonnaise, salads, and cooking oils. Absolutely no gluten, no wheat, no barley, rye, and oats. And then I would also throw in the Vision FX. Go ahead and take 3 of those twice a day. It's 2 bottles a month. And give us a call every couple of weeks. Let us know what's going on. And you just have to really grit your teeth and crank down and be obsessive about the gluten. Got to look at dog food, cat food, bird food, fish food, renters, people coming in to clean the house. Everybody that's in that household has to be gluten-free, including dogs, cats, bird, and fish. All right, Doug, let's go to callers.
All right, let's head to Emmitsburg, Maryland. And Carmen, you're on with Dr. Wallach.
Well, Carmen, you're on the air.
Hi, Dr. Wallach. A guy I met at church, he's 6'2", 170 pounds, 62 years old. He had throat cancer, and he has plaque in his arteries. His throat cancer went away, according to the doctors. And
okay, now, wait a minute. Was that with treatment?
I don't know. He said he prayed, and God said he was healed, and the doctor said it went away.
Okay, well, maybe it wasn't throat cancer. Okay.
Yeah. So anyway, he has plaque in his arteries, and his feet are cold all the time. He says there's no blood circulation in his bottom of his legs where his feet are, and his hands.
Well, that can't be true. Otherwise, his feet would rot and fall off. So there's got to be some circulation.
Well, I told him it might be he needs selenium or plant-derived medical or ceramins, but I wasn't sure.
Who told him? Who told him that there's no circulation in his legs?
His doctor.
Okay. Well, that doctor should go to jail. Okay.
He said he's
Now.
taking Orizapam for sleeping and Adderall for
Mhm.
ADD, and he said he has erectile dysfunction, whatever that is. So I told him I would call you up and ask you because he's a truck driver.
I got you. Okay, so his main concerns right now are the coronary artery disease, blocked arteries, right? Does he have, does he have high blood pressure?
No.
Okay, does he have a back problem, do you know?
I don't know. I didn't ask him about it.
Yeah, you want to ask them that because sometimes nerves being pinched in the back and the sciatic nerves, instead of getting burning or numbness or pain in the feet, they get cold feet because you can't control the temperature of the legs and feet when those nerves are being squeezed. So sometimes it's a back problem, and the cold feet is a peripheral neuropathy like burning and numbness in the feet too, okay? So it could be a whole range of different things. So I'd certainly ask him about the back thing. Okay. So at any rate, here's Shar. Here's a 170-pound-year-old guy. What would you do for him? He's got blocked arteries, and that's, I guess, the main thing since he doesn't, and he's got cold feet and legs.
Well, I'd get him on two, well, first of all, gluten-free diet, but two healthy bone and joint packs.
Okay. And 2 healthy bone and joint packs, good. And what would you, that would be in case he has a back problem, but what would you give him also for the blocked arteries?
I would give him the Ultimate Daily Classic and the Niacin Plus.
Okay, the Ultimate Daily Classic. Go ahead and give him 3 of those twice a day, Carmen. That'll be 2 bottles a month. And they're designed to support and promote healthy blood pressure and support and promote healthy blood flow through obstructed arteries. And also the Ultimate Niacin Plus, I'd go ahead and give him a couple of those twice a day. That'll be 2 bottles a month. And that's going to support, again, healthy blood flow through obstructed arteries. And also, the niacin is time-release and non-flush, and it will, one of the things it will do is dilate the arteries and increase blood flow into everything from the brain, the eyes, the lungs, the heart, and the legs and feet, and so on. So give us a call after you've done all this. And as Shar said, make sure he stays away from all the bad stuff that contribute to blocked arteries, trans fats, heterocyclic means acrylamides. That means absolutely no fried foods, no processed meats with nitrates, nitrites, no oils, and no gluten. Okay, Doug, let's go to callers.
All right, let's head to Florida. And Kathy, you're on with Dr. Wallach.
Oh, Kathy, you're on the air.
Dr. Wallach, it's a pleasure. Thank you for taking my call.
How can we help you?
I have been on the Healthy Start Pack for over a year, and it's been doing wonderful with the added selenium and the Ultimate Daily. I just started taking the Niacin Plus about a month ago, and I only took it for about 2 weeks because every time I take it, within 10 minutes, my face starts burning, my arms, my chest, everything starts burning, and I look like a lobster. So I stopped it. What would cause that?
Okay, well, that's a typical niacin flush, and you may be getting, all the niacin your body wants from your 90, right? And so even though this is designed to be a non-flush, time-release niacin, may be just enough to throw you up over that line to where you're going to see some flushing going on, all right? And it can be itchy and warm and distracting and disturbing to some people. Some people like it, some don't like it. At any rate, what I would do is hold off on the Niacin Plus if you're getting that reaction. And you could try leaving off the Ultimate Daily Classic for a couple of days and take the Niacin Plus instead and see if it does not or still does give you that flush. Okay, that would be an interesting piece of information, okay?
Oh, okay. Well, I was taking just the Ultimate Daily, so I should just stop that and then try the niacin?
Okay, so you're not taking anything else other than the Ultimate Daily?
Well, the Healthy Start Pack.
Okay, Healthy Start Pack. Now, are you taking the Ultimate Daily or the Ultimate Daily Plus?
The Ultimate Daily.
Okay, I'm sorry, it's not Ultimate Daily Plus, Ultimate Daily Classic.
No, not the Ultimate Daily Classic, just the Ultimate Daily.
Okay, yeah. Okay, well, yeah, you can try substituting the niacin for that and see what happens.
Okay.
And we'd be interested in the response, okay?
Yes, and should I just take 1 capsule a day for the niacin?
I would go ahead and take 2. I'll start out with 1. Just start out with 1 and see if that helps.
Okay, wonderful. Thank you so much. I appreciate everything you do.
Okay, God bless. Thank you so much. All right, we got time to start another one here, Doug?
We certainly do. Let's head to Oklahoma. And Gene, you're on with Dr. Wallach.
Oh, Gene, you're on the air.
Hello, Dr. Wallach.
Yes, sir. How can we help you?
Well, I've been on the longevity products for 3 years now.
Mm-hmm.
The first year I got rid of all my medications, which was for high blood pressure, type 2 diabetes, acid reflux, and cholesterol. And in the last few months, my blood pressure and my blood sugar and my cholesterol have risen above what's normal by quite a bit.
Okay. How much do you weigh?
159 is what I weighed in January.
Okay. And you're still taking the longevity products?
Yes.
Okay. Okay, Shar. Okay, here's a guy who initially got good results from the longevity program, and then slowly his blood pressure started climbing up again, his diabetes climbing up again. And so what would you do for him?
Well, I would have him keep a food diary and find out what he's eating, because it could be something like that. And if he's eating gluten, he may not be absorbing, so he needs to get on a gluten-free diet.
Yeah. And Gene, everybody in your family, including the dog, the cat, the bird, the fish, spouse, mother-in-law, kids, people who are renters in your house, roommates, everybody's got to be drop-dead gluten-free. And in your workplace, if you're still working, you need to make sure you're gluten-free. And as Shar said, it's very important, because you're not what you eat, you are what you absorb. And absorption of these nutrients is very, very important. So one of the possibilities is your absorption rate is not efficient enough because of a gluten intolerance. Another possibility is that you're severely underdosing. How much do you weigh? You said 159 pounds. At 159 pounds, I would go with 2 healthy blood sugar packs per month, and I would go with the ultimate daily plastic tablets. Take 3 of those twice a day, and the ultimate cardio sticks. Take 2 of those a day, and do it by body weight here rather than just I don't know how much you're taking. So I double what you're doing. See if that doesn't help you out. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Doug, let's go to callers.
Well, let's head to New Jersey. And Maria, you're on with Dr. Wallach.
Hello, Maria, you're on the air.
Good afternoon, Dr. Wallach.
Hi.
I'm calling on. How are you doing?
Fine, thank you. How can we help you?
I'm calling on behalf of my mother. She's 81, and almost 3 years ago, she had AFib twice. It was heart attacks. She had AFib. So she's a cardiac patient, and her big challenge is her blood pressure goes up and down throughout the day.
How much does she weigh?
Oh, what do you weigh? 195.
Okay, how tall is she?
5'7".
Okay.
5'6". I'm sorry, 5'6".
Okay, any other issues? Any diabetes?
No diabetes, but after the heart attacks, of course, they put her on a blood thinner. So she's been on this Xarelto, and I guess for the first 3 years, she wasn't having any side effects, and then she started to notice bleeding in her mouth. This past weekend, a lot of bleeding from her nose. So her doctor only told her to go off of it for 2 days and then go back on. So when she went back on it, she started bleeding from her nose again. She had to have her nose cauterized and everything.
Mm-hmm. Yeah.
So
I'd ask another opinion of another cardiologist or hematologist. She may have to cut the dose in half.
Right.
Okay, now, I only have a moment here. So, Shar, what would you do for this 81-year-old gal who has a history of AFib and high blood pressure?
She needs to get on 2 healthy bone and joint packs.
Okay, that's for the AFib, because when you have AFib, it's not unusual for an 81-year-old woman to have degenerative disc disease, to shrink, to have osteoporosis, and the vertebrae get closer together and smash the roots of the spinal nerves and actually control the rate and rhythm of the heart. So Shar is exactly correct. A healthy bone and joint pack, 195 pounds, 2 of those, 1 full dose of everything twice a day except for the glucogel, 15 a day, 5 at breakfast, lunch, and dinner. And what would you do for the high blood pressure?
I give her the Ultimate Classic, Daily Classic, and the Niacin Plus.
Okay, exactly right. So I'd go ahead with 2 bottles of the Ultimate Daily Classic, and 3 of those twice a day. That's 2 bottles a month. And the Ultimate Niacin Plus, I'd give her 1 of those twice a day. That's 1 bottle a month. And that's all designed to support and promote healthy blood pressure and to support and promote healthy blood flow through obstructed arteries and to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself, which will then thicken the vertebrae, thicken the disc between the vertebrae, push the vertebrae apart, take the pressure off the nerves, and the AFib should improve or not come back or whatever. And so these are fairly common things in people. I've seen AFib in people who are 12 years old, okay, because they can't absorb. They have gluten intolerance. They're not being supplemented, and they get degenerative disc disease and scoliosis when they're kids, okay, and they can get AFib. All right, and so these are things that you should see a remarkable improvement on. Give us a call every couple of weeks. Let us know how Mom's doing. And she's got to stay away from all the bad stuff. No fried foods, no processed meats, no oils, no gluten, so she can make sure she's going to get maximum absorption. Okay, let's see here. We got time to do a quick one here?
We got less than 60 seconds here.
Less than 60 seconds. So I'm going to go ahead and take it. Remind everybody of all the failed genetic theories since the beginning of time, all the failed medical theories since the beginning of time. Get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Dead Doctors Don't Lie, the book Rare Earth Bin Cures, and Black Gene Lies. Those 4 books are going to shed a new light on all the diseases that our families suffer from. Remember, experts are saying our kids will be the first generation of Americans who do not live as long as their parents. We can derail that prediction, but we're going to have to be obsessive about it. So get these books, learn how to protect your family and yourself, and we can derail that prediction. If you do nothing, that prediction will come true, and you'll be standing at a gravesite burying your kids and your grandkids. A terrible prospect. If we're proactive, we can prevent all that from happening. But we're going to have to take over here. The medical system has failed us terribly. And don't forget, dead doctors don't lie. Okay, thank you so much, Shar. Super job today. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops, and God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
In recent years, several studies have discovered the healthy benefits of drinking coffee. Longevity has now taken it a step further with an entire product line of healthy coffees from Longevity's JavaFit line of top-shelf gourmet coffees. All JavaFit coffees are made from 100% premium, hand-selected Arabica coffee beans grown in the finest regions of Latin America, carefully roasted, creating a delicious, rich, full-bodied flavor. If you're interested in a smooth, delicious coffee but have concerns about caffeine, JavaFit offers our great original roast in a decaf, using the Royal Selected Water Decaf process filtered through charcoal, resulting in a 99.9% caffeine-free and 100% chemical-free, full-bodied gourmet coffee. Contact your local FDI Longevity distributor to get Javalution coffees. And don't forget to ask about home-based business opportunities.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Youngevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels, a formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Youngevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. If you're the type of person who likes to volunteer and help others, this should interest you. What better way to help people than to help them overcome their health challenges? Youngevity has been helping people overcome their health challenges for years. Our approach to health is drastically different than medical doctors who mostly only treat symptoms. As a veterinarian, Dr. Joel Wallach discovered that many common disease states are actually preventable and reversible. Our mission at Youngevity is to educate Americans about their own health. If you like helping people, join us in our fight to save America. While you're helping people prevent and overcome health challenges, you will also be able to build a lucrative home-based business. So what are you waiting for? Come join us and help save America. If you've decided to join us, call your local Youngevity associate to find out how you can arm yourself with the knowledge that's needed to save America.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Youngevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound, turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.